Now propofol, the drug, which is IV, sedative hypnotic, it is used for induction and or maintenance. Okay, in 2 stages it is used in the anesthesia. It is poorly water soluble and onset occurs 30 to 40 seconds after administration. Initial redistribution half-life is 2 to 4 minutes. Action: it will depress CNS and muscle twitching, spontaneous movement, yawning, hiccups, all these, it contributes to these phenomena. Transient pain at the injection site is common. It will decrease BP without depressing the myocardium. It will also reduce intracranial pressure, and it is less of a depressant effect than volatile CNS. It is commonly infused in lower doses to provide sedation. The incidence of nausea and vomiting post-operative is very low. Now barbiturates. Thiopental, it is an ultra short acting barbiturate, high lipid solubility, potent anesthetic, weak analgesic. Barbiturates are supplementary analgesic administration during anesthesia. When they are given IV, agents such as thiopental and methotrexate, they will quickly enter the CNS and they will repress the function, often in less than a minute. Now barbiturates tend to decrease BP, which may cause reflex tachycardia. They will also decrease intracranial pressure. It is no longer available in many countries due to all these effects. Now you can see here the redistribution of thiopental from brain to muscle and adipose tissue. Okay, now comes benzodiazepines. These are used in conjunction with anesthetics for sedation and amnesia. The most commonly is called midazolam. Now diazepam, lorazepam, these are alternatives. All they facilitate amnesia. Minimal CVS depressant effect is seen. All are potential respiratory depressant, especially when they are given as IV. Benzodiazepine can induce temporary form of anterograde amnesia. Now opioids. Because of their analgesic property, opioids are commonly combined with the anesthetics. The choice of opioid is based on the duration of action. Common is fentanyl, sufentanil, remifentanil, because they induce analgesia more rapidly than morphine. Now etomidate. Etomidate is a hypnotic agent and it is used to induce anesthesia. Etomidate is usually only used for patients with cardiovascular dysfunction or patient with critically ill. It inhibits 11 beta hydroxylase involved in steroidogenesis. Now this should not be infused for an extended time because these hormones will be suppressed, cortisol, aldosterone levels, and it can be dangerous. Now ketamine. Ketamine is a short-acting anti-NMDA receptor anesthetic and analgesic. Ketamine stimulates central sympathetic outflow and will cause the heart with increased BP and cardiac output. It is also a potent bronchodilator and it is beneficial in patients with hypovolemic or cardiogenic shock as well as asthmatics. It is contraindicated in hypertensive or stroke patients and it becomes an adjunct therapy. It may induce hallucinations. Now dexmedetomidine. This is a sedative used in ICU settings like clonidine. It is an alpha-2 receptor agonist. It has sedative, analgesic, sympatholytic and anxiolytic effects. It reduces volatile anesthetic, sedative and analgesic requirements. Now what is the therapeutic advantage and disadvantages for inhalation anesthetics and IV anesthetics? This is a very important table. First, desflurane. Its disadvantages is it must be delivered using special vaporizer, but it is a good analgesia, rapid onset and safe, non-irritating. Nitrous oxide. In complete anesthesia, no muscle relaxation, must be used with other anesthetics. Also, it is a good analgesia, rapid onset and safe, non-irritating. Isoflurane, no disadvantage. An advantage is good muscle relaxation, rapid recovery, stability of cardiac output, do not raise intracranial pressure, no sensitization of heart to epinephrine. Sevoflurane, bronchial smooth muscle relaxation, is good for patients with asthma, rapid onset and recovery, non-irritating and useful in children. The disadvantage is renal toxicity. Now IV anesthetics. Thiopental, rapid onset and potent, but poor analgesia, significant nausea, little muscle relaxation and laryngospasm. Ketamine, it is good. Fentanyl, it is good. Propofol does not cause nausea, rapid onset and lower intracranial pressure, but poor analgesia. Dexmedetomidine, no respiratory depression, blunts undesirable CVS reflexes.